No COVID-19 vaccines were withdrawn from states because they were expired. These were the exact words from the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shauib. Dr. Shauib refuted these claims while fielding questions from journalists at a press briefing in Abuja on the progress of the COVID-19 vaccination in Nigeria. He further said the vaccines were withdrawn and sent to other states where the demand for them were high. While stating that Nigeria is expecting to receive more vaccines, Dr. Shauib advised Nigerians who have taken the vaccine to still observe non-pharmaceutical or public health measures. He called on those yet to take the vaccine to take advantage of the second phase in order to protect themselves to avoid a third wave of the pandemic.
Delta variant, we will need a third booster dose for the AstraZeneca vaccine for those who have already taken 2 doses. This is not the recommendation right now. Like I mentioned earlier, having as much of at least 88% effectiveness against the Delta variant is good enough for Nigerians who are taking the vaccines to be protected against this variant. So, for somebody who has taken the first dose of the AstraZeneca vaccine, whether they can now take up the Pfizer or any other vaccine, this again is not the recommendation. If you take the first dose as AstraZeneca, you should take the second dose as AstraZeneca. That because we've taken 2 doses of the AstraZeneca vaccine, all bets are off. Means we can go to town without our face masks, without observing social distancing or hygiene. We still need all of those non-pharmaceutical measures to protect ourselves and our loved ones from the COVID-19 vaccine. Again, we've been very clear about the fact that the evidence that we have is that the vaccines protect against severe disease, against hospitalization and mortality. However, even with the vaccination, it is possible to have a mild form of the disease, right? And it is still possible for you to transmit the virus. This is why it is important for us to continue to wear our face masks, practice social distancing, and do hand hygiene, right? While we continue to gather more information about the nature of these vaccines that we're using for the very first time. There is no vaccine that expired in Nigeria. Like I mentioned during my speech, we still had a lot of headroom in terms of expiry dates for the vaccines. We had vaccines that were due to expire on the 29th of July, but we utilized them way ahead of their expiry date. If there are questions about why vaccines were withdrawn from a couple of states, well, there were some states that had a very large absorptive capacity and they had populations that wanted additional doses. Again, part of the reason for the success of our COVID-19 rollout program in Nigeria is the fact that we use data, right? So we were able to look at the data, look at the absorption, look at the rollout capacities across the states, and we were able to manage our stock balances to make sure that not only was there equity, but also looked at the epidemiology of the virus. So for example, because we know Lagos State is the epicenter of the epidemic in Nigeria, we made sure that Lagos State also got the highest quantities of vaccines, right? So it wasn't a matter of sharing the vaccine equally across the states. We looked at the data, we looked at the epidemiology, and made sure that those states, those local governments that were more likely to have an outbreak of the disease eventually had a little bit more of the vaccines. No vaccine expired in Nigeria. If there are questions about perhaps the number of vaccines that were donated to Nigeria and the exact number of people that were vaccinated, it is normal practice within the immunization phase that as you vaccinate, you have a specific quantum of vaccines that are usually tagged as wastages, right? Because it cannot be perfect that you have 4 million doses of vaccines and you actually immunize exactly 4 million, that is not possible. So if those are the numbers that you are looking at, that is the explanation for that disparity in the numbers.
On their part, the UNICEF country representative Peter Hawkins and the WHO country representative Dr. Walter Molumbo said Nigeria must continue to take measures to prevent the further expansion of the virus around the country and ensure that the next phase of the vaccination is successful.
At that stage, none of us thought that by last Friday all the vaccines would be used. All 36 states plus the FCT reported that all vaccines were utilized. It's an incredible achievement. But should we have been surprised? The network that Nigeria has around vaccination, using it for routine immunization, using it for polio, measles campaigns and other preventable vaccinations for diseases, the integration of COVID-19 has been a seamless and yet a successful integration into our vaccine program in Nigeria. The Executive Director has quite rightly pointed out just under 4 million people have been vaccinated. 1.404 million people have received the double vaccination, and we look forward to the remaining 1.4 million receiving their second dose as soon as is possible. This is a great achievement. But as we have all said, the pandemic is still here, and we must take measures to ensure that we prevent its further expansion around the country, but also we take the measures to ensure that the next phase of the vaccination campaign is equally successful. As Nigeria stands up in the rest of Africa and in the world as a leader on this vaccination, we must prepare through good social mobilization, through the traditional and religious leaders, through community leaders, to ensure that all people understand the criticality of taking the vaccine and the low risk that it has for it. In the meantime, the preventative non-pharmaceutical measures must be taken, the wearing of masks, the washing of hands, and the socially distancing.
Nigeria may not meet the criteria for resurgence, at least for now, but with the recent increase in new cases and report of the highly transmittable Delta variant, we are monitoring them closely. However, the need exists to stress that the Delta variant is dangerous and is continuing to evolve and mutate, which require constant evaluation and careful adjustment of the public health response. With Nigerians' antecedent during the first and second wave, I'm very confident that we can still blunt the impact of these new infections if everyone, everywhere, plays their part by taking precautions to prevent the transmission. While global vaccination rates remain low, there is hope. Vaccine deliveries through the COVAX facility are picking up speed, and we are working around the clock to clinch those sharing pledges and procurement deals with manufacturers to rapidly secure vaccine for most of the African countries.
Over 40 million doses of different brands of the COVID-19 vaccines are expected in the country in the next 3 months, and Nigerians have been called upon to ignore the conspiracy theories about the vaccine by taking it to protect themselves.